This is week 56, and we are so delighted and excited that you've chosen to join us today for this very, very important session. It's just amazing that over these 56 weeks, we have been able to bring this information to you. And I'm excited today to be here with you as your moderator, Yvonne Lewis, for this webinar. And we appreciate you joining us. The Healthy Flint Research Coordinating Center started off 56 weeks ago to bring information about a coronavirus that we didn't know anything about. We have enlisted all of these wonderful partners to participate with us, from our state health department, from our state governor's office, to the individual organizations within our community under the banner of the Healthy Flint Research Coordinating Center. And we certainly want to appreciate you for that today. As we have learned, we started off not knowing anything about this virus and trying to figure out just what it is and how we will live with it. And so we're continuing to bring very important information to you. And thank you for providing us insights and information that allow us to bring you these topics. Today, we're going to be talking about access and availability for vaccines and how do we get scheduled. We have a COVID equity update for you. We're talking about reducing the premiums through open enrollment and then the importance of medical care during COVID. But I want you to know we are mindful that there are things that come up at the last minute, which we're calling late breaking news. And early this morning, we learned some information out of our governor's office that we want to bring to you. So we're going to bring up in our roundtable this afternoon, Gary Jones, who is the representative of the governor's office, and we will also have Dr. Larry Reynolds, who is a health advisor to the mayor of the city of Flint. So I'm going to invite you now to join us in this roundtable discussion. Gary, today we heard from our governor. What are the updates out of our governor's office?
Thank you, Yvonne, for that introduction. And yeah, I'll just hop right into it, and then I'll also just add in a couple of other updates from the past week too as well. But at a press conference in Lansing today, the governor announced that Michigan will hit more than 5 million vaccinations by the end of the day. While vaccine supply has increased dramatically since the Biden administration took office, the state is currently experiencing a serious spike in COVID-19 cases that is putting pressure on Michigan hospitals. So to slow the spread of the virus and protect more Michiganders, the governor renewed her call for the federal government to surge additional vaccines to Michigan, while also urging high schools to shift to remote learning, encouraging diners to choose outdoor dining or takeout instead of indoor seating, and recommending youth sports suspend in-person activities for the next 2 weeks. While many states across the country have dropped basic health protocols altogether, the state of Michigan continues to implement smart health policies and mitigation measures to slow the spread of COVID-19, including a statewide mask mandate, limits on indoor social gatherings larger than 25 people, expanded testing requirements for youth sports, and dozens of pop-up testing sites across the state. Also, too recently, the governor and lieutenant governor released statements after the Biden administration sent a letter to Michigan announcing that it has taken steps to ensure greater access to health care under the Healthy Michigan Plan by removing restrictive Medicaid work requirements that were put in place under the Trump administration. The governor was quoted saying the Biden administration decision to uphold crucial access to health care is life-changing news for the tens of thousands of Michiganders who were in danger of losing their health coverage if the requirements were implemented. No one deserves to be kicked off their health insurance when they need it most, especially in the midst of a global pandemic and historic recession. Also, the governor and NDHHS are urging Michiganders to get tested for COVID-19 upon returning from spring break in an effort to slow the spread of COVID-19. Students and families traveling across Michigan to other states or out of the country risk being exposed to and carrying COVID-19 with them. This in turn could help fuel outbreaks within their households and the communities where they live or visit. And lastly, recently, the governor raised Michigan's COVID-19 vaccination goal from 50,000 to 100,000 shots per arm. Excuse me, let me say that again. The governor raised Michigan's COVID-19 vaccination goal from 50,000 to 100,000 shots per day. The new goal is based on the state's successful effort to expand equitable and efficient vaccine administration by partnering with public and private organizations and communities across the state, and is made possible by continuous week-over-week increases in the number of vaccines allotted to the state of Michigan. And as always, the best catch-all websites, michigan.gov/COVID vaccine and michigan.gov/coronavirus is still the best catch-all websites to keep up with everything.
So thank you, Gary, for the update. Dr. Reynolds, I know this is a very important topic to you as it relates to what's going on in the city of Flint. What are those insights you'd like us to be sure that we pay attention to?
We should be clear and unequivocal. Michigan is a hot spot now, and it's most important that we follow the basic guidelines: wearing a mask over your nose and your mouth, washing your hands, maintaining physical distancing, avoiding crowds. None of those what we call mitigation practices have changed since March of last year, and we must continue to be vigilant. Now we have the opportunity to get vaccines, and it's important. We've made progress in the senior crowd, my group, but now we see the greatest spread, especially of the variants among younger people. And when I mean younger people, I'm talking about school-age people and their parents. And so now it's most important that we take advantage of registering for 16 and up vaccines, and we're still going to have to wait for the development and testing of vaccines for under age 16. But we must be vigilant. We must do those things that Gary Jones just mentioned. And keep in mind, the Flint Community Schools decided about 2 days ago that they would go back to virtual learning. And it was because we took the developing situation in Genesee County so seriously. We were up to 17% positive testing. And that's almost quadruple what it was 6 weeks ago. So we have community spread, and we are trying to control that. And so now I do appreciate, and they also said we will cancel athletic events. And I know sports are important to some people, but we are in the middle of a pandemic. So it's kind of like saying, I want to finish this hand of cards while the house is burning down. That's not going to work. We must understand that we're in a pandemic and we've got a long way to go, and we can only get there if we go there together. So no high school sports for 2 weeks, a pause, virtual learning for 2 weeks. Avoid large residential gatherings. And if you can do it outside, do it outside. And in either setting, wear your masks and maintain distancing. So activities like shouting, cheering for your team, singing loudly, or arguing probably would help spread the droplets that contain coronavirus. So we must continue to wear our masks. And when you go out to eat, I love to repeat what our chief medical officer for the state of Michigan, Dr. Caldoun, says: just because you can do something and something doesn't mean you should go there. Or as Mama said, just because your friends jump off the bridge doesn't mean you need to jump off the bridge with them. We are trying to lower our risks. So do carry out, take out when you go to your favorite restaurant, or eat outside if that is available. But think before you act. And if you walk into a crowded situation and you see unmasked people and they're not maintaining distancing, back on out. Thank you.
Thank you, Dr. Reynolds, and for both you and Gary. I know, Gary, you bring us the information from the governor's office where we want to get more people vaccinated, and the opportunities are there. But we also want to, as you say, Dr. Reynolds, to follow the protocols. Vaccinations does not prevent the spread, but vaccination helps us not be as sick should we actually happen to get the virus. So thank you so much, both of you, for that important information. And we want you to stay tuned because there is more to come. We want to also ask those of you that are listening, we thank you for joining us on Facebook and you join us on YouTube. Please send this out to other friends right now so that they can join us as well. And also we want to remind you, social workers and community health workers, please know and follow the process so that you can get those continuing education credits. So thank you again, Dr. Reynolds and Gary Jones, for that wonderful information. We want to now talk with Sherelle. Sherelle is working with us so closely from the Genesee County Health Department. She's emergency preparedness health educator. And Sherelle, I know you've been out last week at all of these events where opportunities are available for our community. So can you give us that update about availability of vaccines and where, and just what's happening from the city and county perspective?
Yes, I can do that. So we all heard today that Governor Whitmer announced that Michigan will hit more than 5 million vaccinations by the end of the day. As of now, in Genesee County, we have administered 185,191 of those vaccines, with over 57,000 of those being administered through Genesee County Health Department. Our efforts are increasing daily to get vaccinations in arms. We are now offering Moderna, Johnson & Johnson, and Pfizer. Next slide, please. So that's where we are now, and I want to inform that cases are rising in Genesee County. We're seeing an increase in our variant strains. We're also seeing an increase in the wild strain, which is the original strain of the COVID-19. And so it's important that we do register to get vaccinated. It's important that we continue to get tested. In Genesee County, we've made great progress in vaccinating our older population, but there's a long way to go with our younger people. Vaccines have become available for those who are 16 and older as of April 5th. So we want to make sure that we're getting that younger group vaccinated. Right now in Genesee County, only 14% of people who are 16 through 40 are completely vaccinated in the county. And let's go to the next slide. So again, like I said, testing is very important. Right now in Genesee County, we have a positivity rate of 20.3%, which means that 20.3% of our COVID-19 tests have been positive, and that's the highest that we've seen since April of last year. And part of that reason is because we're not testing enough. So we're encouraging everyone at Genesee County Health Department to get a test and make sure that it's a PCR test, and to test as often as possible. On the screen, you'll see some of the sites where we can be tested for free. Those testing sites include Word of Life Church, Bethel United Methodist Church, as well as Macedonia Baptist Church. And we also have other sites listed throughout Genesee County: Walgreens, Rite Aid, Hamilton Community Network, as well as Genesee County Health Center. And as mentioned before, you can go to one of your local urgent cares to receive a test. Currently, in order to register for an appointment, we are no longer doing that by phone. You will have to visit gchd.us or gcforme.com to register. If you do call the number that we've shared previously, there will be someone who can walk you through that process. And I'll share that number again. It's 810-344-4800. So you want to get pre-registered, and then you'll receive an email after registering when an appointment slot becomes available to you, and you can click on the link that the email provides, and it'll allow you to choose where you would like to go to get your vaccine, as well as what vaccine you like to get. And all three options are available. So our locations are on the screen. We do have 2 drive-through locations and quite a few indoor locations. Bishop Airport is happening this weekend on Saturday, as well as Flint Northwestern High School during the week, and Our Lady of Guadalupe Church, Central Church of the Nazarene, Shiloh Missionary Baptist Church, Grace Emmanuel Baptist Church North Bank Center, which is located at U of M Flint, and we still have a vaccination clinic coming soon at Mott Community College. For those who are homebound, the Genesee County Health Department, we are partnering with Genesee County Sheriff Department to make sure that we have a list and that we're getting to our homebound citizens. And age requirements are not an issue. We just want to make sure that if you are homebound and you cannot come to any of the clinics listed, that we're able to get to you in a timely fashion. So you will receive a call from Genesee County Health Department, and we'll set up a date and time to send a deputy out to your home to get you vaccinated. I believe that I've touched on every subject. Did anyone have any questions for me?
Sure, Sherelle, I just want to make sure we emphasize that when we originally started off with the health department, there were limited vaccines and there were the limitations on who was able to get the vaccines. And now that's been opened up. So we want to give some appreciation to our health department for helping us walk through that challenge of the limitation of vaccines and that list of eligibility individuals. So now we want to just be sure everybody knows, everybody 16 and older are eligible. So can you just emphasize a little bit? We know that only 16-year-olds can get the Pfizer vaccine. So is there a process people who have to enroll, because children can't enroll themselves, so parents need to make sure this happens? What is the process that the parents should use for their 16-year-olds and older to 18?
So our parents would just follow those simple steps by visiting gchd.us or gc4me.com. That's GC, the number 4, the word me.com. Click on the link to pre-register, and they're just going to fill in the information for their child with their birth date and everything else. And we'll send an email to the email address that the parent lists for them to later on be able to schedule an appointment for the vaccine and location that they can make it to with their child.
Thank you, Sherelle. So everyone now is eligible. Please make sure you follow those guidelines so that you can get that call or email about an opportunity for you to get vaccinated. If you have questions, we're asking you, please put your questions in the Q&A area on your screen if you're joining us in the webinar. And if not, you can give us a call at 810-835-2130, and we'll make sure we get those questions answered for you. Thank you so much, Sherelle. One of the questions that's come up is, now that everyone's eligible, what about insurance coverage? And I know a couple of weeks ago, Dr. Reynolds specifically asked us to bring Jim Melanowski back, who is the CEO of the Genesee Health Plan, to talk about what's happening with open enrollment. Who's now eligible? What opportunities are available to get a reduced rate on the healthcare coverage available through the ACA Affordable Care Act? Jim Melanowski.
Well, hello, Yvonne.
Good afternoon.
Yeah, normally we kind of get in this rut about complaining about the federal government and not usually a lot of good news, but this actually was some really good news that came about a couple of weeks ago. So thank you for this opportunity to share. So as you know, last fall, there's usually every fall an open enrollment period for what we call the Affordable Care Act, Obamacare, the Health Place Marketplace. It has a lot of names, and I think that sometimes adds to the confusion of enrollment. But that was extended, and now it's extended through August 15th, so plenty of time for people. And the Biden administration passed a new law called the American Rescue Plan Act of 2021. And some of it really does make healthcare more affordable for people. That has been one of the biggest complaints about the Affordable Care Act, is it wasn't as affordable to a lot of people as it had hoped to be. So under the new law, many people who buy their own health insurance directly through the healthcare.gov will become eligible to receive increased tax credits to reduce that premium cost. There are also some of the premiums have also decreased, and some of them on average by $50 per person, or $85 per policy per month. So that's, you know, $500, $600 to $1,000 savings for an individual or family. So, and what they're saying and promoting is that 4 out of 5 enrollees should be able to find a plan for $10 or less a month after premium tax credit. So those are definitely some good news, good changes that have taken place. So certainly you can give us a call, or if you want to do it yourself, you can log in on healthcare.gov. But there are our organization, GENESEE Health Plan, along with other partners in the community that can help with this. Next slide. So who are really the targets of this extension of time? So so uninsured. So if you're talking with somebody and they mention to you that they do not have health insurance, really now is the time for them to really look for this. So uninsured individuals, they might have just lost a job, or they might have not had insurance for years or maybe forever. They might think they don't qualify for something. That includes a lot of what we call seasonal workers, people who might work part-time or intermittent. Maybe they're bus drivers, maybe they're landscapers. What we call gig workers, people who work in music industry or singers or entertainers. You might know somebody like that, and they've seen, because of COVID, their hours reduced. And again, most of these people do not qualify for any, or are not offered health insurance through an employer because they really don't work for somebody. They usually are working independently. Again, there were a lot of people who lost their jobs and lost their health care coverage. And so people who make up as much as 400% of federal poverty level, which is $51,000 for an individual, $69,000 for a family of 2. So this is pretty significant. So it's really this open enrollment period is for those folks who make less than that. So that's a wide gap there between making nothing and those income levels. So there's got to be something for everybody there. So, and then again, more tax credits to lower premiums. So again, those are all eligible for people who are at that 400% of federally poverty level, that $51,000 a year for individuals or less. So there's a lot of opportunities there. There's a lot of people who just don't think, as I said earlier, that they qualify for anything, or they've never had to look for assistance before. You might know somebody like that, and they might be very proud. They don't want to seek assistance, but during this pandemic, and even before and after the pandemic, you do not want to not have healthcare insurance. You do not want to be stuck with a bill if something happens or you get sick. And you also want those you want healthcare coverage also to cover preventative services like mammograms and other services that are available that help us figure out if something is wrong early and detect it early so that treatment can happen. We talk a lot about disparities on these webinars and health inequities, and so we want to target people that are in those categories. So again, lower premiums, probably you'll save some money. Plans include doctor visits, preventative services, and prescription drugs. Coverage can begin basically May 1st if they sign up now on healthcare.gov. Next slide, please. So there's some people that might have already signed up this fall for healthcare coverage, and that's great. They still qualify for these additional savings. They just need to go back on and go online and update their file. They can choose a different plan or keep their old one. They can see if there's a change in cost. And again, that might save them a few extra dollars. So again, we're certainly available. We assist people virtually and over the phone, so we don't, people don't have to come face to face to see us. And then we also have great partners in the community like Greater Flint Health Coalition and Hamilton Community Health Network that have trained staff just like ours to help assist people in helping to figure out this enrollment. It's not easy, and so it's good to have people that are trained in our community that can assist people in figuring out what are the best qualifications, what do they best qualify for, what are these premium decreases, what are tax credits, trying to make things a little bit easier for people. And one of the reasons why we talked about this a few minutes ago about affordability, as you can see, when the Affordable Care Act first came out during the Obama administration, 2014, you saw this really large increase in enrollment. In Michigan in particular, there was about 350,000 people who went and enrolled into that and got coverage. But what they found out was sometimes it wasn't affordable. And they might have chose a very inexpensive plan, but it didn't cover as much as they needed. And so we've seen a decrease since 2016 in enrollment in the state of Michigan, as well as in Genesee County. So where we were at in 350,000 about 4 or 5 years ago, down to about 250,000. So that means there are uninsured people out there. They might have gotten jobs, and I hope that's one of the reasons why that number dropped. But we all have an obligation to look out for those people and to really give them the heads up. So if you don't remember anything else I say today, if you are talking to somebody who says, I don't have health insurance, there is some help and there is some solutions out there. And no kid, especially in Genesee County, no child should not have health care insurance. So you can certainly contact us by calling us. You can visit our website and get more information. And Yvonne, if I could take 1 minute to talk about the health plan. And on our website, if you go to that website page, it details a essay contest for students in Flint as well as in Genesee County. We've been doing this essay contest for 6 years, and we have a great sponsor in Savita Credit Union. And this is for elementary kids, 5th and 6th grade and up through middle school and high school, that can write an essay. It doesn't have to be a very long essay, and it's about what we call their health heritage. They're talking with their family, their parents, about what health conditions are prevalent in their family and how it has affected their family. And especially this year with COVID and disparities, we talk a lot about disparities. There's a lot of things for these children to write about. And it's one of my favorite things to do in my role, is to read these essay questions from children and adolescents on talking to their family about their health history and how it impacts and then again, we've added some more information about COVID and health disparities. And we've already gotten, hundreds of essays that have come in, and we just want so many essays to come in, and we would love to share that publicly once we get those in and share those stories about how their families are dealing with some of these health issues. So you can go on our website. There's information on that contest. It's students are eligible for prizes. Their teachers might be eligible for prizes. Even parents are eligible for prizes, gift cards and the like. And then there's also, for those seniors in high school that are looking to go into a healthcare field or a health-related science field, there's an essay contest for them as seniors. And if you're a poor parent like me who's put kids through college, $1,500 scholarships are available. Thank you to Savita. So please go to our website, check that out. But you also, about enrollment, open enrollment, can find out all that information there. And I'm going to stop, or else I'll get the hook here. So.
Yeah, thank you, Jim. I was just about to pull a hook on you, but I think the information is so important. Because, when we talk about these inequities, we don't realize how important it is to go back and even help our young people understand. And one of the things we found out in previous years too, is that some of the young people really have some good ideas about how to deal with these health issues. and they bring those ideas forward to their parents. So we want to thank you for that opportunity to hear more about the essay contest. But Jim, there was one additional question. A few months ago, we were talking about work requirements, and I understand that something came from out of the governor's office that their work requirements are no longer going to be a problem for people.
Yeah, those are kind of off the table at this point. That had me really worried for over a year, because we were kind of ramping up to assist those people that had a Medicaid, or what we call the Healthy Michigan Plan. But those work requirements now are no longer part of people keeping their coverage. So good news on that. So a lot of good news about healthcare enrollment.
Right. So we certainly want to appreciate our governor and those in the legislature who work toward talking with our federal government about not having those work requirements necessary for our residents in Flint, Genesee County. So thank you all for your advocacy, because it makes a difference. And we want to continue to remind you that your voice really does count. Now, one other thing that it was brought to our attention, we're talking about healthcare coverage, but insurance is no longer a requirement when you go to the free testing site. So Sherelle, I thank you for making that clear to us, because we're talking about healthcare coverage. But when you go to the testing sites for your tests regarding COVID, and you're going to get your vaccines, there is no insurance requirement. The insurance companies are taking care of that. You don't have any out-of-pocket costs for those things. So thank you for giving us that heads up, because it is important as we move forward. Thank you, Jim. It's important that we understand, as was mentioned before, we do need health coverage because we still need to go to the doctors. And Dr. Woolford is here today to help us to understand the importance of, even in the midst of COVID, where we started off before, it's still incredibly important that we pay attention to what's happening so that we do get the medical attention that we need. Dr. Woolford, give us some additional insights on what is happening here in our community with our ability to get the care that we need.
Thank you so much, Yvonne. Yes, at this time, normally I'd be saying that it's important, if you have symptoms, to get testing and seek care if needed. And I would be talking about coronavirus specifically, and with good cause, right? Because it is spreading so widely. And last year, it was the third leading cause of death. But today, I want to actually focus on the leading cause of death in 2020 and almost in every year. I don't know how many of you would know, but it was heart disease. Heart disease was the leading cause of death last year. And what is very interesting about this is that the number of deaths from heart disease are actually increasing during the pandemic. And so I can sense Yvonne is going to ask me, why is this cause of death increasing so much? Well, for a number of reasons. One, we think that people are avoiding care, right? So you might think you have symptoms, but you don't want to go to the emergency room because you don't want to be exposed to COVID, and so you don't go. Well, that's a real problem, particularly if you are indeed having a heart attack. You need to seek care. And of course, there are other things that are happening during the pandemic that are also making it more likely that one might have heart disease. I don't know about the rest of you, but the studies are showing that indeed the pandemic pounds are real. People are gaining weight. We are eating things that possibly we shouldn't, at least not as much of it. And that is impacting our risk of, in fact, getting heart disease. And also, we've talked about stress. We've talked here about the problems of stress during this pandemic, and that is increasing it as well. So there are all of these factors that the pandemic is causing. Yes, we have to deal with the risk of possibly dying from COVID, but we all, in a way, have to, walk and chew gum, because at the same time, we have to deal with the issue of how we protect ourselves from having a dire outcome or a really, really bad outcome due to heart disease. And so the other question that I know that Yvonne would ask me is, well, how do we do that? How do we protect ourselves from it? So clearly, now that we know the things that have an impact, we will address those things. So if you think you are having symptoms, you should seek care. And I wouldn't share something with you to do that I wouldn't do myself. And so I want to say that a few weeks ago, I started feeling little symptoms in my chest, and I felt, that's a bit odd. And it's important to note that while chest pain is the classic sign of heart disease, having a heart attack, so chest pressure and pain, discomfort, but for women, it is different. Women, it might be just sort of something down your arm, it might be back pain, it's much more vague. So, but if you think, I thought I was having something, I really wasn't sure. I tried to minimize it. My mom said, don't minimize it. I called my doctor. I went in. I had the EKG. I had the stress test. They told me I'm as fit as an ox. But, it was better to know that than to sit at home. And indeed, I would need to have care or need to seek treatment. And I didn't get it because the results are very bad. So seek care if you need it. Try to do what we can to address those other factors that are impacting heart disease. So such as what we're eating. I love to have my oranges, and I'm always showing you oranges for you as a virus. But today I'm showing it cut for something to eat. I won't eat it on Facebook Live because it will look dreadful, but eat your fruit. Do what you can to reduce your stress, reduce the likelihood of increased weight, high blood pressure, and high cholesterol. And the final word on this is, if your heart hurts, don't hide, get help.
Thank you, Dr. Susan. And you anticipated all of my questions except for one. And that is, so we are saying, yes, go to the doctor, but there are some protocols, yes, even because of COVID, that we must follow. So can you just kind of reiterate those?
Yes. So if you think you're having a heart attack, you call 911. Do not drive yourself to the hospital. Get somebody to do it for you. Take an aspirin if you think you are having a heart attack. If you're not sure and you feel you have time, then you can call your doctor. Call your doctor, speak to the person on call, get advice. So there are two things. If you think you're having an acute heart attack, you call 911, get there. If it's something less than that, then you can call the clinic and get advice, which is what I did when I had those symptoms.
Thank you, Dr. Wolford. You always bring us something interesting to think about. And so now I'm going to take that fruit example and eat it this next time. So thank you so much. And you raised the issue of stress. And we really have today an opportunity to get an update on one of the projects that's going on here in our community that helps us to look at resilience. Oh, I'm sorry. I was moving to the wrong one first. So we really want to thank you for looking at the stress and traumas that are in our life, but we also want to understand how this impacts our whole issue of the disparities and where all the ideas come from, the data comes from that helps us to know what's going on in our community. So I want to welcome Dr. Deborah Verholden, who will come and give us an update on our policy brief.
Thanks, Yvonne. I want to echo the sentiments of the other speakers. There's a lot we can do. And I really want to acknowledge our great governor and top doc, Dr. Joneigh Khaldun, for coming on and giving us kind of the state of affairs in Michigan. So here's what I want people to know. The cases are going up. Cases have doubled in Flint and Genesee County. Even just since last week, confirmed cases increased from about 150 per day to about 300 per day. And we know without intervention, we are nearing our fall COVID numbers. Let me show you what that looks like. If you go back into when we were really at the height of this, back in November, you can see our case counts were in the thousands each week. That week there, 11-15, we're well over 2,000 cases per week. So we're not quite there yet, but the goal is for us to not get there. We did a really good job at turning the tides. And like Dr. Reynolds said, we made some decisions. I think a lot of our leaders have been in tough spots and they made decisions trying to meet in the middle, I think. And now it's time for us to acknowledge a lot of the reopening and some of the other things have gotten us dangerously close to where we were. So I just encourage everybody, keep doing your part. Even once you're vaccinated, it's just so critically important that you continue to honor protocols, because those protocols are going to be the thing that if we collectively do that and can continue to get that government support, we can dial things back. All right, so now let's look at where we are in disparities. We now have a re-emerging missing race data problem. I will say our wonderful health department has done a great job at backfilling that race data in the past. A lot of it isn't being collected on the outset. And so they go back and they backfill that information with data from people's electronic health records, or they literally are contacting people so that we can not only monitor cases, but make sure that we don't have a reemergence of disparities. Well, as you can imagine with the vaccine rollout, people and our organizations have become overwhelmed. So they're not able to do as much of the work to go back and backfill that data. So we've got now about half of our data on COVID cases are missing race. It makes it very hard to say where we are on the disparities. What I will say is we are working very, very hard for a legislative push to require all testing providers to require them to collect that data at the time of test. It is important to me. It is a foundational piece of the puzzle. If we want to address health disparities, if we want to go further upstream and address health inequities, we've got to understand the extent of the problem. So no bad actors here in our county, but a lack of policy has us have a lack of data. And that's something that I think we should all be pushing for. I'm going to hand it over to my wonderful colleague, Mary Catherine Crawford, who's going to give us a little bit more insight on what geographic spread looks like and give you some pointed recommendations about how to talk to your policymakers.
Great, thanks, Doc. So thanks, everyone. I'm happy to be back with you this week. So we can head right to the next slide, and you will see what this graph looks like, showing case rates by population. And you'll notice that the highest areas of spread through March have been in Linden, Benton, Argentine. So think like the Lobdell Lake area and Grambling Townships. So if you look at the map on the opposite side, what you'll see is cases per square mile. So you actually see a different story. So I do want to make sure that people really understand why it's important to look at the data in these different methods, these different ways, because the map would indicate that you would have the greater risk in Flint, or that's where we're seeing the most transmission, which is actually not the case. So when you look at that in comparison to local population numbers, you really see a different story.
Can I just say one quick thing, Mary Catherine?
Yeah.
So we do have more cases in Flint, but that's because we have more people in Flint. The cases are a function of the people. We wanted to look at rate because we wanted to understand the number of people contracting the virus relative to the number of people in that community. If we just gave you this bar chart by cases, it would look like Flint is off the chart, when in fact, you can see the number of cases relative to the people in the population. Flint is much further down the list. Doesn't mean take our foot off the gas, but I don't want people to digest the narrative that Flint is somehow some big, huge outlier. Quite the contrary. I want to salute people for doing their part and ask them to keep doing their part.
Yeah, absolutely. Absolutely, Doc. And so that's why we're sending this information out every week. So stay informed, signed up for the brief to continue to get this information and this data. So next up, let's dive right into policy recommendations, because there's a huge opportunity for our policymakers to foster inclusive economic growth. And that is simply by including a variety of community voices at the table as leaders prepare to budget the millions of dollars received by the city of Flint from the American Rescue Plan, which Jim talked to you a little bit about. So our policymakers and elected officials can, need to do this by surrounding themselves with philanthropic, business, and civic community members to promote engagement and ensure equitable budgeting. And this is also really important for transparency too, because then you actually have the community members involved and part of the investment process. And with a nod to transparency, I'm going to talk about the missing data, which Dr. Verholten also referenced. So the federal mandates placed upon these health authorities to report COVID testing data is really like having gums without teeth, because as you know, we're not getting the data back. However, with authority, the Michigan Department of Health and Human Services could change this. Point of care facilities that aren't reporting this data could be subject to fines or other forms of penalization if policymakers put forth legislation so that we can actually start mandating equity. And then the last thing I'm going to talk about is we need to continue to communicate the need for COVID health related and safety measures. Again, I'm going to reference what Dr. Verholten said. It is not time to take our foot off the gas, especially as cases just continue to surge. And so measures really need to be tailored to address the threat of COVID spread among different populations driving transmission. And then as always, please go to the Genesee County Health Department website, gchd.us/COVID-19 volunteer to register to sign up and volunteer at a upcoming clinic or vaccine site.
Thank you, Mary Catherine, for bringing us that update along with Dr. Verholten. You said something very important about the importance of community voices and as well as community getting involved in helping to determine how money is utilized. There are millions of dollars coming in our community and many opportunities. And one we want to appreciate is what's happening with ReCAST. And Afton Shavers is here with us today to talk a little bit about what they've already done in terms of distribution of funds to community organizations to specifically focus in on youth. But Afton, I know it's so much more that has happened through ReCAST. So can you we ask you to come back and give us an update. And I know there's more that you want to share with us. Afton, are you there?
Hi, Yvonne.
Hi. I want to see that bubbly face and voice coming forward.
Sorry, for some reason it wouldn't let me. It wouldn't let me unmute myself, but I think I'm good now. Can you?
There you are.
You can hear me now?
I can see you and I can hear you now.
All right. So sorry about that. Yes. So thank you so much for an opportunity to come back and give a program update. We were able to come on and share with the community when we released our request for proposals for ReCAST. And so we wanted to give everybody an update on what we did with those requests for proposals, what's happening now with those projects, and something really awesome that we've got coming down the line. So just to remind everybody, we did a request for proposals for 3 goal areas that we wanted to really support our community around. The first is looking at youth and families developing resilience. The second was about mitigating health impacts of the water crisis and really providing support to the folks that are doing the work in communities. So our community health workers, our nurses, our social workers, so really providing them with some support on the back end. And then lastly, we wanted to increase, evidence-based programming, but really thinking about providing opportunities for kids to develop resiliency skills through art, music, dance, photography, and some of the really cool things that are happening in our community. So folks applied and let us know that they were interested. We had 30 people that applied by our deadline. We reminded everybody a lot that we had a 1 p.m. deadline. So 30 people applied on time by our deadline. And so that's what our committee was able to review applications for. We originally said we were going to award between $5,000 and $15,000 awards. I'm happy to say that the smallest award we gave out was $7,500. So we actually gave out a little bit more than we were anticipating. And so these projects are taking place in community from February through September. There's a couple that will be summer projects, but we're super excited to just sort of give you the list. So next slide, please. 19 of our 30 applicants were awarded funds. And so this is the first time for the list here. Some of these folks will look familiar to a lot of our community partners that may be working alongside some of these hardworking individuals. And we also have some newbies. We are super excited because a couple of our grantees, this is their very first grant that they've ever received. So we're happy about that. We really wanted to tailor this to be an opportunity so that everybody could apply and have equal opportunity to get funding, not just the big guys that have, the staff that are able to, create big sort of grant requests. So looking at some smaller organizations that really kind of needed some support for sustainability. So those are our 19 awards. That's the second set on your screen. And then we just wanted to remind you, next slide, please, that we still have these trainings that are available for community. So all of these trainings that you see here that are happening through our wonderful friends over at GENESEE Health System, these are all free and available. They repeat monthly. You can sign up by going to geneseehealthsystem.org, or GENHS.org is the actual website in case you are not looking at our screen and listening to us over the phone. But GENHS.org, when you go to the website, there's a very large ReCAST logo on the right side of the screen. Click there, and that's how you can sign up for any of these classes that are available. We're still working with critical crisis incident stress management program. So that's really helping, once again, our first responders on the back end. Super excited that we're still doing that. And next slide, please. We are still doing our coffee and conversation series. So this is for parents. We created this to help parents kind of talk about what's happening, managing those stress behaviors, managing the virtual life space. We've had some forward, some backwards, some in between in terms of what we can do with folks connecting with each other. And so we really understand that for parents, this is tough, right? So you're working, you're managing, your new workspace, your new virtual life space, and teaching second, third, fifth grade. It is a lot. So we wanted to give parents an opportunity to support one another, get some help from, the actual school system. And so we partnered on this one with GENESEE Health System once again, and also our community education initiative, those folks that are running the community programs inside of all of our Flint schools. So all parents, if you're interested, you can absolutely join us. We've included the Zoom link, so you don't have to pre-register. You can just grab the Zoom link. The meeting code and password are right there. We are really pleased to announce that all of Flint PD completed mental health first aid training. So yay, Flint PD. We're super excited about that. We just really wanted to get that off the ground and get most of our officers trained. So thinking about, once again, stress management and how those things come together in the wake of a pandemic, that is critical. Last slide that I have for you today. So May is Mental Health Awareness Month. So we have an entire month of activities that we'll be sort of planning out, sharing about over the next couple of weeks. We'll be bringing you some updates about everything that's happening. Everything that's a part of Mental Health Awareness Month is free and open to the public. So we'll be getting you information about all of our activities that we're kind of working behind the scenes on. We've got 2 or 3 things that are going to be really amazing, and we really want to give more back to our community. So that's all I have for you today. Thank you very much for the time.
Yvonne is being great on mute.
Goodness. How about that? Thank you so much, Afton. Appreciate all of that you're sharing and the work that's been done by the 19 community organizations. They're really focusing in on increasing the opportunities for our youth. And so we want to encourage you to continue to do that. Our youth are our legacy. They're going to bring so much forward for us. And we appreciate that insight and work that's being done with our youth. I also want to remind you, when you say Mental Health Awareness Month, this is also National Minority Health Awareness Month. And many of us may not know that for over 30 years, we've had a National Office of Minority Health, and we also have a State Office of Minority Health that's continuing to work toward bringing important information and supports for our community. And so we want you to pay attention. You can go on the CDC website and learn more about National Minority Health Awareness week. And we will be giving you some more insights in the upcoming next couple of weeks from the perspective of the Healthy Flint Research Coordinating Center. Today,
really quick, one more thing, Yvonne.
yeah.
July is also Minority Mental Health Month. And so we're going to have a whole month of activities coming in July as well.
Yeah, and in the midst of, after you did say that you had some work going on with respect to the water crisis, and we saw all of those mental health programs, we have still a lot to work on with the stress and trauma of the Flint water crisis. We don't talk about it as much as we did, but it is still very much in the minds of our community members. I know for me, I think about it all the time. As a senior citizen, I have no idea what will happen in the next 20 years when I look at my life and see that there might have been some impact from the water crisis. So that mental stress that we sort of bring along with us every day that we don't think about, it continues to be there. So we want to be sure that we encourage our participants to utilize all of the resources that are being made available for us. Thank you, Afton, so much. As we prepare to close today, I want to remind our community health workers, we thank you so much for the hard work that you're doing every day in our community, even in the midst of COVID. There's an opportunity for you to continue to receive CEUs for the work that you're doing. And by participating in the webinar, you're receiving information that we trust you're able to use as you work with the individuals in our community. So please follow the process to get the CEUs. We also want to say to our social workers, for those of you, and it's by request, for those of you that are looking for continuing education credits as a social worker, please register as you attend the webinar. Register through the Zoom so that your attendance can be verified. Go into www.hfrcc.org and then enter the email address so that they can, on the back end, get you all the information that you need in order to get the social work credits. We certainly appreciate Gina Gimble. Her email address is trement3@msu.edu. That's Gina Gimble at trement3@msu.edu. She can answer any questions for you, along with Marley Sherrod at Sherrod, SHERROD 7@msu.edu. We appreciate MSU, University of Michigan, Michigan State University School of Social Work, Michigan State University School of Social Work, who has worked along with the Healthy Flint Research Coordinating Center to provide this opportunity for you. So we certainly hope that you will utilize this opportunity to get those credits that you need to maintain your certifications. Today, we want to thank you all for joining us. We ask you to continue to like us on Facebook, www.facebook.com/HFRCC. Subscribe to our YouTube channel, Healthy Flint, or you can always email us at info@hfrcc.org. That's info@hfrcc.org. In addition to that, you can call us at 810-835-2130. Again, that number is 810-835-2130. And we're going to be here next week. But before we leave you today, we have one more really important announcement that we'd like to keep before you when we're talking about the importance of the work that we're doing and we're seeing these differences. This won't happen without our participation. I'm going to ask Dr. Deborah if she'd come back and just give us a couple of more sentences about why it's important to mandate equity.
Thanks, Yvonne. This is really, I think, the push that we need. What I've observed in our communities and communities all across the country is you got a lot of really passionate, brilliant people doing a whole lot of work. And I just think what would be possible if our legislators gave us some legislative pull for all of that work. We actually had guidelines and guidance from the CARES Act requiring all COVID testing providers to collect basic demographic data. In the absence of any enforcement of that, it simply has not happened. And look at where we are. 50% of our data in a county where we want that kind of data is missing, but it's out of our hands. So we need the laws, we need our legislators to use their legislative power and their authority to support actions around fair and equitable healthcare access and racial equity. We need them to legislate, and then we need our executives to enforce those laws. So I just ask folks, join the movement, #mandate equity. Use it in your social media. We have an open letter out to President Biden asking him to require that these data be collected for tests and for, most importantly, vaccines, because we've seen what happens. The hundreds of millions of doses of vaccine with a question mark over them. Millions of doses of vaccine, having problems in the plants that are now not going to be coming out into community. So we have a supply demand problem. So it's important. If people want to join the movement, reach out to your legislators, let them know it matters to you, and check us out at www.mandateequity.org. Thank you, Yvonne.
Thank you, Dr. Deborah. And we can continue to see how important it is for each one of us to stand up, speak out, and that our voices be heard. One person alone cannot do it. We need these hands joined together to make a difference. That's why we again appreciate you, each one of you, whether you're on the phone, whether you've joined us live by Facebook, or you've even joined us in the Zoom webinar itself. This would not be possible to make the difference in our community as we have been able to do without you. So again, let me thank you for joining us today for the Healthy Flint Research Coordinating Center Flint Community Webinar on coronavirus. And we will look forward to sharing again with you next week on Friday at 12 noon. Thank you so much for the hour that you spent with us today, and join us as we continue to move forward.